All right, Damon. Good evening. My name is Carol. I'll be your nurse today, and I'm here to perform your neurological examination. Nice to meet you. I've washed my hands. I've provided privacy to the patient. Privacy to the patient, and I've already explained to Mr. Webster what I'm gonna do. Okay, so first, in terms of the neuro examination, I'm gonna start by testing his cranial nerves, right? I'm gonna, first one is olfactory, would be cranial nerve number one. So usually we don't do this in practice, but olfactory is to test his sense of smell. So you can have either coffee beans, explained in the video, or you can have lavender. And what we'll do is that I'll ask Damien to occlude one ear at a time. You occlude your own ear, and then tell me what you smell. We'll just pretend it's coffee, and then he'll occlude the other one and tell me what you smell, lavender, right? And that's cranial nerve number one. For cranial number two, we're gonna check his optic nerve. We're gonna do his optic nerve, and we're gonna also, with the optic nerve, I'm gonna shine the light into his eye. I'm gonna check for direct and his consensual vision. What that means is that I'm gonna check his reactivity to the left eye. How does it react to the light? Does it get bigger or smaller? And if when the right eye gets bigger, does the left eye react the same way? That would tell me direct or consensual vision for his pupils. Okay, and that will be cranial nerves number 2 and 3. Okay, so I'm gonna dim the light. Voila. Okay, and I'm gonna have my pen light here, and I'm gonna lean forward, and I'm gonna say, gonna come in and look. Okay, and I'm checking the reactivity of his eye. Good. Good. So from this, I can see that his pupil is 3 and they're brisk, right? I'm also checking the nerves in his eyes as well too. Yeah, just a tad bit as well too. Nice. Excellent. And when his right pupil gets bigger, his left pupil reacts the same way too. So I'm sorry, I'll turn back on the light as well too. So both pupils are equal bilaterally, and they're bilaterally and 4, and they're briskly reacting to light. Okay, so for cranial nerves number 3, 4, and 6, right? I'm gonna have him. I'm gonna have you follow my fingers. Oh my God, I can't remember. So I'm gonna have you follow my fingers, right? So you're gonna look at my fingers, right, with your eyes, right, and don't move your head, right? Going, excellent, excellent, right? So I'm checking to see if there's any nystagmus, right? If his pupils cross midline, right? If one pupil reacts differently than the other, and both his pupils react same way. So we've checked his cranial nerves 3, 4, and 6. Now we're gonna check cranial nerve number 5. I'm gonna ask Damien to clench his jaws, just squeeze quench your jaws, and puff your cheeks, right? Like, oh yeah, I'm showing you. So just do that, right? While I press it, right? Very good. Okay, and then after move it from side to side as well too. Sorry. Excellent, right? So we're looking to see if he has any if one part of but bilateral his face reacts the same. If maybe one part of his face is not moving as opposed to the other, which we have in stroke patients, or at times patients with bald palsy, they have paralysis to one side of the face, and he doesn't exemplify any sign of that. Then we're gonna go to the hearing test, right? So we're gonna occlude your ear, right? And then tell me what I say, right? 99. And then we're gonna do the other side. Baseball. All right, excellent. Okay, and after that, we did the hearing, did that, and we're gonna your ability to swallow. We're gonna check your ability to swallow. So I'm gonna ask you to open your mouth, right? We're gonna swallow for me. I'm gonna watch, try to take a swallow, yeah. And open your mouth for me as well too. Right? Shine light in your eye. Try to swallow from there, right? Okay. Do that, right? And then also say ah.
Ah.
So we're looking we're looking for deviations with his tongue, and make sure his tongue is not deviated to one side as opposed to the other, right? And then we're also looking at his mouth to make sure there's no paralysis to any one side over the other as well, right? Then I'm gonna have you check for your accessory muscles, right? Where I'm gonna have you gonna place my hand on top of your shoulder, and I'm gonna show you. So I'm gonna ask you to shrug your shoulders, right? So you're gonna try to push up against my resistance, right? So try to push up. Yeah, very good. Okay, you got it. Okay, strong. So these accessory muscles are in place, right? Then I'm gonna I think we did that, right? So then we're gonna try to test your muscle strength, right? Okay, so first we're gonna start by having you hold your arm. So we're gonna check for, well, everything we're gonna do for extension, flexion, and abduction, and as well too, right? So I'm gonna have you hold up your hands. So you're gonna hold up your hands and hold them out like you're holding a pizza box. Close your eyes, right? And you're gonna count to 10, right? I'm gonna count to 10, right? So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. So I'm looking to see if he has any drift, right? If his arms, if he can hold his hands anti-gravity, which he can. If his extremities are flaccid, which they're not, right? He held them upright, right, at the time when I did testing, right? So then I'm gonna ask him to pull his hand in, right? And then I'm gonna ask him to not let me pull his arm. So don't let me pull your arms out, right? I'm gonna try to pull your arms in, but try to hold them as tight as possible, right? Okay, fine, brilliant with that, right? And I'm gonna also push down your arms in, right? All right, don't be so strong, right? So try to push it, not to put. Okay, try to not have me push down your arms, right? So try. Come on, let's do it. Yes, exactly, right. So he tells me that he's strong, right? And his muscles are intact. Now we're gonna try to check his strength, right? So hold my hands. All right, so pull me towards you as strong as you can, right? Oh, thank you very much. Now push me away. Thank you very much, right? So I'll give his upper extremities a 5 out of 5, right? Next, we're gonna check also his fine motor coordination, right? So I'm gonna have him, so you're gonna use your thumb to touch your fingers, right? And then you're gonna do it to the other hand as well. Very good. Now you're gonna roll your fist around, roll it the other way, right? And this will show me like if he has any issues with ataxia, coordination, which are all like neurological function, which some stroke patients, when they don't have, they'll exhibit it. Okay, and so far so good. He's intact, right? Excuse me. Okay, then we're also gonna do the same thing for his legs. All right, so I'm gonna have you're gonna try to lift the leg up. Right, now let me push down. Very good. This one. Excellent. Right, now I'm gonna have you plantar and dorsiflex, which is gonna mean you're gonna push on the gas, right? And then you're gonna lift your toes up in the air, right? Very good. Excellent, right? And then also for the sake of the video, I'm gonna ask him to lift his legs up to see if he can hold them up. Hold them up. Let me count. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Excellent. All right. Now I'm gonna have you let me push your legs down, right? Okay, good. What about the other one? Good. And I'm gonna push up against them. So don't push down on the force of my hands. Yes. Push down on my hands. Excellent. And he was able to push down. Well, he was able to push down on my hands, right, against resistance, and he did fine with that. Exam is concerned, right? After that, we can check his sensation. All right, so close your eyes, right, and I'm gonna touch you, and you're gonna tell me if this is sharp, right, or dull. Don't look, you gotta close your eyes, right? Okay, so ready? So tell me, oh, I'll use this. Okay, so you're gonna tell me if this is sharp or dull. Okay, ready? Is that sharp? Okay, what is, close your eyes. Dull. Okay, and then can you tell? Sharp. Mm-hmm. Sharp. Okay, I'm gonna ask you to now. We're gonna check your sensation. Now, tell me, you're gonna tell me where I'm touching you, right? So I'm gonna touch a part of your body. You're gonna tell me where do you think I'm touching you, right? And also, I want you to tell me if I'm using one hand or both hand, right? So first I'll do, am I touching you, right? So am I touching you? Yes. All right. Am I touching you? No. All right. Am I touching you? Yes. Yeah. Am I touching you? Yes. 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 Okay. So tell me if it's both hands or one hand. Both hands. Both hands. One hand. One hand. One hand. Both hands. Okay. Excellent. 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 Okay. So from there, we can check. Check. I gotta think. Okay, I gotta think. Hang on. So I did that. So in the meanwhile, right? So we can now check your reflexes. Okay. So the reflexes, we're gonna check. No, don't do it. Don't do it. Okay. So we're gonna check your. No, you're supposed to be dependent. So this is bad. Well, okay, Professor. So maybe we could do the hand. But put your hand on the. So maybe turn yourself around. Because you're supposed to be relaxed. Because then it won't work. No, not like that. Relaxed. Like the hand's supposed to. Maybe Professor. I'm gonna try to hold his hand to see if I could do it, so to speak, right? And then I'm gonna have the hammer and hit my finger to see if he has. But technically, it's reflexible. His hand's supposed to be relaxed, right? And then I will hit. Okay. It's not going to do it well because I can't. Let me have set up better setup. Okay. And his fingers are supposed to have the jerky motion, right? Or supposed to react towards it. Need to figure this part out. Okay, I'll just go on. All right, and we'll do the same thing for the left hand as well. Then we're supposed to also do the his leg as well too. So we'll find the knee, and then we'll go in between. You're not gonna see because the chair is you're touching the too tall. Brief intermission. Well, I see your toes do it, but it won't show in the video because you're too tall. All right, Professor. Maybe I have to do that part of it. But that's the premise of it, is that you're supposed to hit the joint and see the reflection of the bilateral feet. You're supposed to do it with the knee and also the Achilles as well too. I don't think that part out. Okay. And then I'm disappointed. Okay. And then we're gonna check your gait now, right? Okay, so let's check your gait. So a part of the neuro assessment too is checking his mental status. So while we are doing these things, I would be conversing with Damon about, his social history, what's going on with his life, to see his recall, if he's a good historian, if he has good short-term memory, if he has good long-term memory, and things of this sort. And this is an ongoing process throughout the examination period to make sure to see if he's alert and oriented, not just times 3, but not just to like the common things that we all remember, but just to everyday things. Maybe I'll ask him like what's something going on with the news to see his sense of recall as well too, because that would check his short-term memory. And then maybe ask him something I guess like maybe where he was born or things like that to check his long-term memory. And like I said, we will converse all the time to see if he can make sentences too, because at times with stroke patients, you know, they might have good long-term memory, but they can't they don't have good short-term memory. They have issues having recall with sentences as well too. And then I'll ask Damien questions like what is this called? What is this called?
Pen.
All right, and what color is the pen?
The pen is blue.
Okay, yes, and we'll check his cognition by asking him those questions as well too. Last but not least, we have to do his gait as well too. So I'm gonna ask you now. How do I turn it on again?
Don't turn it around.
Huh?
Don't turn it around. Don't turn it around.
But I have to see what.
I have to turn it the way I want to see.
Like that. It has to be like that. Yeah. So then stand up then. I have to see you walk. Oh, okay. I'm not having technical difficulties. Okay. So we have to see you walk. Okay. So we have to. I would ask Damien to walk. So, Mr. Webster, could you just walk a straight line for me? Right? Okay, very good. Right, so we're looking for his gait to see his movement. If he's swinging from side to side, right, for lack of better words, right? If his walk is if he's able to hold his balance. So can you walk back to the couch for me, please, sir? Okay, so I'm gonna ask you to do a couple of things. I'm gonna ask you to walk, so you're gonna walk walk on your heels for me first. Wait. Very good, good. Make sure you stay in my frame, please. Thank you. All right, excellent. Then I'm gonna have you walk walk on your toes. Oh, you know, yeah, I remember. And I'm gonna have you bend at the knees. So you're gonna do like a jerky, yeah, and go up. Yep. Take a step, do it again. Yeah, right, good. And then you're gonna come back to me, walk again, and walk heel to toe now. Like so, like walk like you walk in the line, like you got pulled over. Not like that. Go back. Heel to toe. In one foot in front of the other. Maybe I'm giving bad instructions. One foot in front. No, Damien. One foot in front of the other. You must be drunk.
Yeah.
In front of the other, like this, like you're marching, like a soldier, sorry. Like you're a nutcracker. Yeah. I think you're drunk. Thank you. Oh my God.
Nice.
Okay, and I think, but I don't want to think. Am I missing anything?
You want to do the reflex on the dining table? I can sit on the dining table.
Huh?
I can sit on the dining table. And do the reflex thing again.
I don't know. It will work. I think I gave the premise. If you have to do it over, do it over. All right, Professor. And that concludes my neurological assessment video.